Hi, my name is Georgina. I'm the midwife you'll be working with today. Hi, I'm Maddie. I'm a fourth year midwifery student. Thanks for working with me. So the scenario we're participating in is for a patient who has just had an epidural. Do you have any specific learning goals you'd like to achieve? I have an IDC MCAT that I'd like to complete. Fantastic. Have you had a look at the assessment tool? Yes, I've done the learning at university and have seen and done a few IDCs that I feel confident to do that under your supervision. Great, let's have a look at the tool together before we start so we know exactly what needs to be assessed. So in addition to performing the actual skill, we also need to ensure you maintain communication, practice ethically and safely, and involve the multidisciplinary team when appropriate, and document the care provided. Do you feel like you're ready to be assessed for each of those things? Yes, I do. Great. Before we start, do you have any questions? No. Let's get started then. Before you enter into the patient's room, is there anything you'd like to collect or anything you'd like to access prior to commencing? I'd look up the hospital policy for IDC insertion, as this can vary between organisations. However, I've previously looked at this policy at this organisation, so I feel confident I know what needs to be done. Great. Anything else? I'd also collect all of my equipment: a catheter pack, IDC bag, normal saline for injection, sterile water for injection, a 10 ml syringe, a leg strap, and an IDC trolley. Fabulous. Then I'm going to go into the room and discuss with the patient why we'd like to insert an IDC. Okay, before we go in, what are some of the potential complications that might occur whilst you're performing this skill? The epidural might not be working well yet, so the patient's vulva might still be quite sensitive. Good job identifying that. What would you do in that case? I'd wait until the epidural was more effective. How long do you think you'd wait? Well, I'd check the patient's dermatome level. If their block was higher than my first attempt, when they were in pain, I'd try again. And if their block was not higher, I'd escalate to the anaesthetist for a review. Amazing. How would you do that? I'm not sure. The midwife I'm with usually does that for me. I can show you afterwards how we do that. Thank you. Any other potential complications? Inserting the catheter into the vagina rather than the urethra. Very true. This sometimes happens, but it's not the end of the world. How would you identify this and what would you do? You'd suspect the IDC is in the vagina if you're not getting any urine draining. That's right. And to fix it? To fix it, you leave the catheter in the vagina so you know where not to insert it next time. Fantastic. And if you are still struggling to insert the catheter, I'd go to my midwife in charge, clinical support midwife, or a clinical midwifery educator to ask for help. Great. Any other potential complications? Not that I can think of right now. Fantastic. Are you ready to go ahead into the patient's room then? Yes, let's go. Please don't hesitate to ask me questions as we go along. I'm here to support you.